welcome you to our this session of Uncovering India. I congratulate you and your entire team of MDTok for coming up with an online platform for people in India to access to top line medical practitioners sitting in US, and so that they can get the medical attention that they need in this COVID hour. So please take us through this online platform and the journey behind it. What is this about, and why did you start it?
Yes, thank you, Shashwat, for having me here to speak few words. Definitely, it's a collective effort, and I think this is the least we could do from here for the motherland. I'm native of Nasik, and came to here in US for higher education. Same with my colleagues who are my batchmates, who are also part of MD Talk, and they helped us to build this platform. Is Dr. Gupta Nishant Sangore, he's also a doctor from Canada right now, and Dr. Himraj Gaidani is a husband of our batchmate, Dr. Swati Gite. So, Dr. Nitin Thakre is also based in Nasik, who supported us as well. So, it all started with all these small calls from family, friends, and relatives where they would ask me about, what do you think about this, blood sugar level? What about this report? So then I saw that, there is a extra opinion need that is required by patients in India. And I try to formulate that in a small tele-diabetes clinic. And as we proceed further, with diabetes management, the requirement, the options to explore other specialties, kept ongoing, kept increasing. So I, along with help of all these other colleagues, we thought of, why not create an official platform? And thanks to John Pletka and Glenn Morton, they both are the brain behind the technology who helped us to build this platform. And that's how, we thought of providing opinion for patients in India from doctors from the US. And this COVID-19 hit, and I think there is no other better time to actually implement this platform and have rest of the doctor utilize this platform to serve back to home or to motherland. And just because of that cause of serving back to motherland, yeah, we were very overwhelmed and surprised to see that more than 500 doctors have joined just last few weeks, and almost 2 to 3,000 consultations are being done every day throughout India. We had more than 20, 25 lakhs visitors on the website just last 2 to 3 weeks. So that tells us about the enormous problem that we have right now in India. And obviously the healthcare is overburdened, and doctors there are also so busy with managing all these COVID patients. So something, the least we could do to support them, support the education, support the anxiety and the fear that is there in the minds of people. So that's what the MD Talk is all about right now.
So how does this mechanism work? Can you please explain us?
Sure. So, I try to keep it the way reaction happens in a real time clinic where patient go and talk to the doctor. So in virtual clinic, the advantage is, you have the option or ability to choose your doctor, choose their appointment, and put your question in advance, attach your reports for the review, and then just wait for the appointment day. If it is on the same day, then you enter the appointment room and wait for the doctor. And same way, the doctor get the appointment, the notification saying somebody has booked the appointment, and when the time comes, they also enter the waiting. So that way, we can actually do a video call with each other. And since doctor have all the reports in advance, they review the reports, and when the appointment happens, they can discuss about what are the options, what are the questions they have. And after the appointment is over, we also have a physician in India who's sitting in located physically in India, who will follow up with the patient, or who usually does all the follow-up calls and make sure if they need any prescription or any kind of help or any questions they have, he or she is able to answer those. So there's always a follow-up call, because a lot of restrictions are there for doctors who are sitting in US. Sorry about that. So those restrictions we wanted to like bypass and give some support even in Indian level. So we do hired a few physicians in India who support these follow-up calls and make sure that patient get the complete care.
So what are the
And it is for free, obviously.
what are the typical queries that your team of doctors are attending to? What is the kind of questions or queries or doubts that are posed to you all?
Right now, whenever we, interacted with doctors, because of obviously patient health information privacy, we didn't want to, get more information about what exactly they need. But they, in general, told us that patients are there to ask for, what is the next step? What about this result? What should we do? The oxygen is uh, currently around 91%. Should we go to the hospital? Is this tablet good tablet to take it for corona or for COVID? Or most of the patients who are already over with COVID-19 and are in the post-COVID complication zone, they ask about how much time will it take to recover. So most of the questions are about uncertainty and fear, and also about the treatment plan, about what should be taken next, and when to go to the hospital, when not to go to the hospital. There are a lot of information running around in Indian social media about treatment options or prevention options for corona. So they want to validate those, and it is always get better to follow a proper guideline or proper information source than just running blindly and taking the advice or calls from unknown resources.
So there must be difference in treatment protocols regarding COVID or comorbidities involving COVID in US and the protocols that are allowed in India. So how do you tackle with this difference sitting in US? Because back home the requirement could be little different as far as the government notifications and guidelines are concerned.
Yeah, that's a very good question, and that is the challenge we faced in the beginning. And if you see our website, we strictly wrote there that this is not an emergency service, and obviously this is more of an opinion service. Most of the discussion that happened were about counseling, patient education, grief counseling about the loss of the lives. But yeah, we definitely always recommended that the ICMR guidelines, the Minister of Health guidelines need to be followed. If it is a doctor to doctor call, there are a lot of doctors also having communication with doctors from US. There's a big organization of Association of American Indians in US. They have this group calls with the doctors. So during the calls between the doctor, they discuss about the treatment options or the guidelines. But with the patient, it's mostly about counseling, patient education, medication education, and follow up with their regular doctors for any kind of treatment changes. So most of the prescription the patient would need is mostly for the supportive treatment like cough syrup or temperature, which is already available over the counter. Anything extra than that, we recommend to check it with the doctor locally available. Because as you said, the prescription writing is not allowed by foreign physicians, and the guidelines and even the disease course is different in both the countries. So right now it's more of solving the questions that patients are struggling to find in terms of what is to be done next.
A lot of comorbidities regarding COVID has been found to be diabetes. And that is the number one
Mhm.
comorbidity as far as COVID is concerned. And you have a team of doctors who are also specializing in diabetes care. So, how do you look at this situation? What kind of opinion or advice do you give to such patients?
Not just diabetes, but any chronic medical problem, whether it is having underlying previous cancer, diabetes, heart disease, any issues with liver, issues with your blood disorder, all of those comorbidities contribute towards complication of, post-COVID or COVID-19 pneumonia. So anything we get, like, when COVID-19 hit the country, it didn't mean that rest of the complication or rest of the problems are gone. They are still there. Patients are still struggling to get the treatment or the at least the care the way they used to get there before. So from consultant perspective, the clinic that we started was specifically for COVID-19. So rest of the opinions are merely for guiding them to minimize the risk and minimize the complication. Let's say somebody needs to have a change in the regimen of diabetes for insulin or medication. We obviously do not write the prescriptions for it, but we recommend when to take the next step and when to get that appointment with the endocrinologist as soon as possible versus they can continue the same treatment for another couple of weeks. COVID does hit with diabetes because one of the line of treatment is steroids, and that kind of changes your diabetes profile too. So obviously the opinion is always the first part, and chronic medical problems we right now are managing COVID-19. So anything that regards to anything outside of COVID-19, we obviously only provide the opinion and then follow up with the specialist.
So it's a free platform, right? Free consultation platform.
Right.
So how much has been the time since it was started? When was it started?
We designed this for last almost a year and a half, but from April, I think April 27th is when we deployed it on the website, and then May 1st was when we added all the doctors. So from May 1st to now May 19th, so almost 19 days it is like.
So what is the average number of hits or calls that you get, queries that you get? Do you see the numbers increasing by the day as the cases are intensifying back home?
Yeah, yeah. First week of May, we were surprised to see we reached that number of almost 1.7 million hits just in first 5 to 6 days when we launched it. When the organizations from US spread the word about having this platform available for free consultation. Lot many patients from Southern India, Western India, East India, West India, they all came from. When we run the Google Analytics, we have any minute there are around 200 to 300 users accessing the website, making the appointment. We followed up with the doctors as soon as they open up the appointment. Their appointment gets booked right away. Lot of kids or the son or daughter or daughter-in-law, son-in-law, they are booking the appointment for the parents who are staying in India. All these kids are outside of India, and they wanted to have some help for their parents who are living in India right now. So those are also making significant appointments for their parents.
So, what would be your message for our viewers? What would you like to tell them about this service and how they should and why they should avail this? And any general message that you would have for my viewers?
Sure, yeah. So first message would be always, that for any questions, concerns, even if you have a second doubt what is to be done next, do not hesitate to book the free consultation appointment with any specialist we have. We have more than 300 doctors. So that way, at least whatever step you take, you will have an informed decision to make and with full awareness of what you're doing and why you're doing it. So COVID-19 specialist clinic is something to support the current like mayhem or the chaos that's going on in India. So basically, as long as we provide the patient with right information, right education, I think they will be in a better position to make an informed consent or informed decision. So it is free service. Please make sure that when you book the appointment, you upload your reports, and for any queries, questions, you can always rebook the appointment.
Any generic message that you would like to give other than about your service? Since we are in such difficult
Uh,
times, anything you would like to say?
yes, yes, yeah. See, life is about living with peace and making every second count in our life. So as we are passionate about this cause to serve motherland, I think these difficult times are there and they will be over soon. So whatever you have in your life right now, take care of it. Be thankful for everything that we have so far, and always be nice and I would say be a good human being because things are really tough everywhere in India, and if we just be if we just be supportive to the fellow Indians, I think it will make a difference.
Thank you so much, sir, for taking out time for this conversation and giving out such valuable information. Sir, just one thing. This platform has been made by all the NRI doctors, all Indian origin doctors.
Yes, yeah, they are all Indo-US origin. Yeah. So basically, Indian origin who are settled in US. Also, doctors from Singapore, from UK, from UAE, from Australia have also joined hands. So
Okay,
we started
so
that in US, but lot many doctors from Indian origin from other countries also have joined.
NRIs from all over, NRI doctors from various parts of the world have come together to serve their motherland using this platform.
That's
Uh,
right.
It is a great feeling to see that such efforts are being taken for the country, even not being in the country. We are honored to have you all around us, sir. Thank you so much for your time and your efforts. Wish you all the best.
Thank you so much.